We're hearing that some hospitals are running out of beds, that there's long wait times. Is there a chance that things might get worse now that the holidays are here, kids are around family members as they come together to celebrate?
Well, sure, there's a chance of that. It's hard to mitigate that without looking at the overall numbers. But we do see these seasonal surges, so I don't think there's a reason to panic at this point. RSV really affects the youngest children. It affects infants the worst. Older kids can get it, but they really just end up getting a cold. So I don't think there's a reason to panic at this point. We do tend to see seasonal surges in RSV. This year is higher than usual. There's a lot of reasons that people are talking about that, but we are seeing a surge. There's some concern about volume in hospitals and in walk-in clinics, but I don't think things are at the point where we're being overwhelmed yet. So I think we just have to, plow ahead forward.
Really fast, is there anything that parents need to know to keep their kids out of the hospital?
Well, it's just general measures as far as avoiding these things: hand washing, making sure that your kids, wash their hands when they come home and are taught, good hygiene. Teaching them not to touch their face is important. Very hard to do with young children, but it's just routine precautions. And keep a close eye on your kids if they're having trouble breathing. Parents are smart and they know when their children are at risk. So it's really just common sense stuff at this point. No reason to panic. We're all pretty smart out there, and it's just time to have good common sense.
I agree. Thanks for the tips. And thank you, Dr. Frank Contessessa, for coming on today.
Thanks, Christina.